Welcome back to News at Noon, everyone. I'm Troy Thompson. Joining me, of course, is Dr. Eric Smith over here at Georgetown Bariatrics and Advanced Surgical Services. Good to be with you again, buddy. Thanks for sticking around. Now, the new location, we are doing our interviews in your classroom.
Yes.
That people actually get to come and experience when they're doing the seminars if they're not doing an online one, right?
Correct.
What goes down in the classroom?
Oh, a lot. So they can do a seminar here.
Yeah.
They don't have to go to the hospital anymore. Everything's done here if they do it in person. When they have their very first visit, they'll have education in here. I do a talk with them about diet and exercise, what exercise really means, heart rate-based exercise. We teach them how to calculate their heart rates and their max heart rates. The dietitian comes in and does a class with them as well. All of our teaching takes place in this class, support groups down the road and everything else.
Well, you are probably the busiest surgeon when it comes to weight loss surgery. People would want to know at home, now I've just stated that again, are you accepting new patients and are you enrolling?
Absolutely. Yeah, we absolutely are accepting new patients. The point of building this, a large part of that was to accommodate those patients. And so we're hiring more people and we're creating more room to bring people in because we have a lot of people interested in coming to see us.
And I was just told out at the front office that you are opening evenings now for appointments. What does that entail?
Yeah, so we're going to extend our office hours into the evening for people who can't get off from work, and it's tough for them to be able to come in. So starting probably in December, we'll have late evening hours where patients can come in and still get the same services provided to them for their regular follow-up visits as well.
And the important thing is give them a call and find out exactly what those hours are so it can work into your schedule. I want to touch very quickly on a new program that you put together here. Instead of just the surgical weight loss program, you've got the medical weight loss program. We talked about it a little bit before, but how is medical weight loss different from surgical weight loss?
Well, medical weight loss is for a couple different scenarios. For somebody who their weight may not be high enough to qualify for surgical weight loss, we have options for them, whether it be medications, customized diet plans, and our new PA is a licensed dietitian as well to follow them through that. You also may have somebody who had surgery maybe 3 or 4 years ago and they need a little help getting back on track. Maybe they put a little bit of weight back on. We do revision surgery here too, but if we find that a revision isn't going to help them, then they just may need some help. So we can still apply our medical weight loss program to somebody who maybe's put a little bit of weight back on as well.
I'm glad you opened that can of worms for me because I was going to ask you about revision surgery. Now, people assume revision surgery, is that skin loss surgery or is it the weight loss surgery, and what is it entailing?
So if someone had a weight loss surgery procedure years ago and they put some weight back on, sometimes there's some things with their surgery they had years ago that may not be working well for them. And there's surgeries that we can do to help that, whether we convert them maybe from a sleeve to a bypass, or someone had a bypass but they were left with a pouch that was too large and I can reduce that. And those are surgeries only done by people who have a lot of experience with that, and unfortunately a lot of programs don't offer that, but we do offer that for patients if it's the right thing for them that will get them the results that they need.
I want to ask you, when you just talked about the revision, if someone was maybe 3 or 4 years ago, how long is the lifespan of these surgeries?
The surgery lasts forever. If it's done the right way, it's going to last forever, but a patient has to be compliant with their habits along with the surgery. So that's why we make sure that if there's some changes in their lifestyle need to occur, I don't need to operate on them. We just need to give them our resources here to get them back on track.
All right. Well, I want to tell everyone at home that you have some exciting news coming up for 2021. You're going to be on a TV show.
Yes, yeah.
But how much can you tell me?
Not a lot.
Because it's one of my favorite shows.
Eventually we can. But, you know, we're going to be on a very well-known cable network doing a surgical weight loss program. We're excited about it. They reached out to us and we were very honored to be a part of that. So in 2021, we'll be seeing that and we'll get to talk more about it when it comes out.
It was only a matter of time, my friend. They saw you on the shows here. Do you know what I mean?
I owe it all to you.
Stick with us, buddy. We'll be back after this short break. There's all the information up on the screen for you. Georgetown Bariatrics and Advanced Surgical Services. The next thing we want to talk about is the health and safety practices when it comes to COVID-19 here at the clinic.